Manual therapy. So what is it and why do we perform it? The first thing is, it's not a massage. If you go to your physical therapist expecting to get a massage, you're going to be sorely mistaken. Usually manual therapy hurts. And if it's not hurting, or if it's not something that you find in relaxing, then it probably isn't doing anything for you. I like to think of massage therapy as a nice way to release muscles and to get some relaxation, but it doesn't serve a purpose as far as improving your function. That's what manual therapy is. And because that's what manual therapy is, it should be performed before you start doing your exercises in physical therapy. A lot of times physical therapists will have you start off your treatment with doing a short 10-minute warm-up to get the muscles warm, to get your core body temperature warm, and then they will do manual therapy to increase the range of motion in a joint, to increase the length of muscle tissue that you have so that you have better mobility, and then have you do a series of constructive exercises that will enhance your function. So maybe if you can't throw a ball because your arm won't go all the way back, we'll do some range of motion to get that motion back into that full position where it needs to go. And then we'll do a series of exercises getting you throwing, getting you accepting that throw, using that new range of motion that we just gained with manual therapy. So we're trying to stretch the tissue, stretch the joint in ways that it should be going, but because of your injury, it isn't going into that position. And so I'm seeing a lot of physical therapists out there that are having people do corrective exercises and then performing manual therapy after the fact. What is that achieving? That you feel really good on your way out the door to go sit in your car, or to go back to the office, or to go back to your house and just do light activities? It's not really providing you with any benefit. So if you're in physical therapy and you're experiencing this kind of routine where they have you do a whole bunch of corrective exercises and then they give you manual therapy before you leave the office, ask yourself, what is it that they're trying to achieve? Because if the physical therapist can't explain that, then maybe he's not even thinking about what's going on with your treatment. So it's a little bit of a tidbit. Everything that we do in physical therapy has a purpose, and how we do those things and in what order we do those things is how we achieve better function overall. Just something to think about if you're already going to physical therapy, or if you've been to physical therapy in the past and what they've done. It's an interesting concept, and it's not steadfast. Sometimes there are reasons why we may want to do some manual therapy after a series of exercises, but for the majority of the time, it should be done before your exercises. So that's my thoughts for today. I hope that you'll stick with us and listen to some of the other thoughts that we have about physical therapy, because it really is your job to be questioning your physical therapist, to be asking these types of questions so that you can demand better care for yourself.